way. Okay, now you start to look like one of those TV shows, right? And you're looking at the needle sticking up into the liquid, and you pull it down past where you want it to go. So I'm going to give a half a cc. I'm going to pull it past a half of a cc so that there's some little air. And then the reason I'm holding it this way is so the air is at the top. The liquid is at the bottom and the air is at the top where the needle is. So I pull it past the half a cc mark, and then I push the air back up into the bottle. Let's see. You might have to go back and forth a couple of times until the top of that black plunger is on the line. All right, maybe I should draw a picture here so you can see what I'm doing. Hold with me. Okay, so it looks like this. Don't go away. So here's the syringe. All right, here's the syringe. Here's the needle, and this plunger is a solid black thing like that. Okay, can you see that? It's a solid black thing. This top part of the black thing is where you measure the liquid from there to there. You don't measure from here because this is rubber stopper, right? You want to measure from top of here because that's where the liquid is. All right, so now I've got it pulled back in here. I pushed all the air out into the bottle, but then I pulled it out of the needle because I don't want to throw away what's in the needle. So now I have it down into the hub, and there's a half a cc plus a little bit, whatever's in the needle. Now I'm going to take this needle off. That's the big one that's going to hurt you. Take that one off, and this one is a 27 gauge needle, which is much thinner, 1 1/4 inch. 27 gauge. Most of the pharmacies don't carry this, and most pharmacists will tell you that you cannot give testosterone cypionate through this tiny needle, but you can. Okay? It just takes a little bit longer to push it through, but it's worth the extra time because you have hardly no pain. All right, so now I pull this cover off and I push that up. I'm watching because I've got the air at the top, and I push that up until all the air is out and I see a little bitty bubble, a little bitty drop appear at the top of that needle. And when I see that, I know I have all the air out. All right? Then I'm going to recap the needle without touching the point, because the sharper that point is, the less pain I'm going to have. All right? Now this is how to give a shot to yourself. All right, so here's my leg, here's my knee, here's the other end of my leg. All right, knee, down here's the hip. You want to divide the leg into imaginary 4 things. You don't have to draw on your leg. I'm going to draw so you can see. You want to divide it side to side and end to end in half. All right? So from side to side in half, and from hip to knee in half. Now you have 4 squares. You also want to divide it from front to back in half. Again, you don't have to draw on your leg, but there. Now, the square that's safe to give a shot is right here, in this square. The one that's on the outside, closest to the hip, and on the front. So here's the square. Hopefully you can see that. Here's my knee, here's my hip, here's a line in the middle, here's the square. Now, here's the medicine we drew up. That's the amount for a female who wants to take 50 milligrams. It's half a cc, and that would be half of 100 milligrams per cc. That's for a male who took 100 milligrams, that would be half of a 200 milligrams per cc. Now, here's the way you give a shot to yourself without hurting. And if you're giving it to somebody else, all right, let's do it 2 ways. If you're giving it to somebody else, you wipe it off anywhere in the square. There's nothing but muscle and bone there, so you can't hurt yourself. You do not have to put this whole needle in there. I like these longer needles because some people have enough fat that you need the longer needle to get through it. But most people are lean enough, you can just go about halfway and you're into the muscle. Testosterone deposited into fat does not do so much. It needs to be in the muscle so the circulation carries it away, and this shot will be good for about 2 weeks for a male. Well, it depends on the dosage. Talk to your doctor or to me if I'm your doctor about that. But this is a long-acting shot. Okay, so you wipe it off. Now, if you're giving this to another person, you hold it like a dart. Can you see that? You hold it like a dart. And then you wipe it off, and then you quickly, the faster the better. there are automatic injectors to try to take the pain out of giving a shot, and one part of what makes them not hurt is they're quick. And people seem to hesitate. You need to know, you need to be snap, you don't need to be violent, but you need to be fast. The quicker you get through the skin, the less pain, because most of the pain fibers are on the skin, not in the muscle. So it's like, poof, pop it in. Now if you're going to do yourself, I think a better way is, all right, and I'll get to the injections part in a minute. I'm telling you how to make it not hurt to go in right now. If you're going to inject yourself, you put it next to the skin like that, alcohol, and then you put it next to the skin, and I think if you're going to give it to yourself, it helps to sort of look away. It helps to be sitting down so the muscles relax, and you look away and you have almost no pain if you just go ahead and push it through the skin. Okay? Here we go. And there, now it's in the muscle. All right, you see that? That is in the muscle. I'm having almost no pain. All right? Now, here at this point, if you're going to give it to yourself, and that's not good, I just kind of dropped it, but if you're going to give it to yourself, you take your hand and you hold the hub like this, and then move your other hand around like this, and push it into the muscle. Now, it takes a little minute, but this is better than using that big old nail that it took to get it out of the bottle with. Now you would use this same technique if you're giving it to your spouse or your friend to give a painless testosterone injection. Okay? You see that's only about halfway in, but it's in the muscle. And once it's all the way down, I'm having to push pretty hard, now not into my leg, but push pretty hard on the syringe. Now when you're ready to come out, you don't have to take your time about it. Quicker the better. So you just pull it out. And then put the other hand immediately on the spot where you gave the shot. All right? Think about it. When you cut a piece of steak, what happens? The blood sort of oozes out of it. When you give a shot, when you give a shot, you have a little dot of blood that appears at the surface of the skin. What does that mean? It means it's bleeding into the muscle, and you're seeing this dot appear on the skin. Well, that bleeding into the muscle leaves this feeling as if you have a goose egg in your muscle, and it hurts for a few days. But if, as soon as you give the shot, you pull it out you pull it out when you're finished injecting the medicine, but as soon as you pull it out, if you put your hand on that place, not rub it, there's no sense in that, you just hold pressure for a full minute. But if you hold it for a full minute, when you take your hand away, unless you have clotting problems because you're taking a bunch of aspirin or Coumadin or something, there will be no bleeding. You won't need a Band-Aid. In my opinion, if you need a Band-Aid, you didn't hold it long enough, and so you're probably going to have a sore muscle because it oozed into the muscle. Okay, so that's how you give a painless testosterone injection. And if you're doing that, you're either my patient or hopefully another physician's patient. Do not be taking testosterone without the supervision of a physician. It's a controlled narcotic in the United States, and if you're getting it any other way than through a doctor, of course, okay, I'm preaching now, but you're risking going to jail, and you're risking your health. So take care of yourself. If you're my patient, of course, you can call me anytime, but hopefully this video helped you figure out how to give the perfect, most wonderful, painless testosterone injection. If you want to know more, if you just found this video and you're not my patient, about testosterone and how its effects on the body and libido and sexual function, brain, and to preventing dementia and helping heart disease, go to my website at Temple Repair. Your body is a temple. Temple Repair, all one word, templerepair.com. Thank you.